de la Comisión Médica.
Thank you. Thank you for the invitation. Thank you to Urs, to all members, friends of the UIAA. And sorry for the Italian dress code, but I lost my luggage, and I have only this clothing today. And you are tired, but I am tired, but I try to be, where is the, here. To be fast and to involve you in this presentation. And the aims of the presentation is to provide new suggestions, innovative suggestions about treatment of critical ill patients in difficult environment. The history of medicine teaches us that some operations on the field that seemed impossible are now in common practice with exchange between experience, intra and extra hospital experience. And the most important factor is before it's necessary a simulation of in the training in off and in difficult environment. All of you know the effect of the climate change on the everyday life and on the work of everyone. And this is most important, obviously, in difficult environment, also in the mountains. And extreme events have become not only more frequent, but more destructive, impacting the morphology of the territory, but above all, the daily human activity. An increase in temperature pushes, especially in the summer period, we talk obviously about Alps, a lot of people in the mountains, a lot of people often poorly aware and concentrated in a few famous resorts. Have mountaineering understood as access to high and very high altitude has been an increase in the last 20, 30 years. Always entails an increased risk of accident with many people injured in the case of extreme weather events. 1 month ago, in the Alps, under Matterhorn, 6 ski mountaineers died for a sudden storm and from hypothermia. And this is the example of the necessity to improve the capacity of care in the field. And the warming in face of ever decreasing possibility of skiing has led to a rediscovery of the mountains as place for alternative sports, often extreme, and we must not forget, but we must above all think about those who live and work in the mountains. They are the first garrison in the care of the mountains. People who were in the mountains and people who live in the mountains. It's completely different. A recent case study about Italy. Italy is a universal paradigm of climate change because mountains and sea and the extension in latitude and the different climate conditions from north to south show 22 more extreme weather events. And the past July freezing point record at 5,300 meters in the Alps. In the past week in Italy, in April, we had the freezing point at 4,000 meters. It's a crazy situation. Obviously, how we can carry out prevention work and how can we rethink the rescue in such a different and increasingly dangerous situation, also due to the possible large number of people involved. And how should we do high-level trauma health training and education for rescuers? And how can we adapt increasing innovative and advanced rescue technologies? We will start from the territory. Tomorrow in the panel discussion, we will talk about organization, health organization in the Alps and in the Andes. But if we think about the first point for the care and in the weather extreme accidents, we must think about the heart. The heart can be first aid base, triage point, telemedicine base, education point. And this is a graphic about the health organization in Switzerland, and you can note that on the back there is the word communication, and it's the same in the USA because big distances, but it's a little different, obviously, the organization, but on the back there is the same word, communication. Communication is critical. It's the first important point in the treatment, in the first treatment of the patients in the difficult environment. Communication during the trip, trekking, excursion. For the local people, first diagnosis, chronic pathologies, and the communication must be effective, fast, and must send as many data as possible. And the paradigm now, after the pandemic in particular, it's the telemedicine. We talked about telemedicine 11 years ago in Brixen, in the International Mountain Summit, and to the people, not only health people, doctors and paramedics, but people who work and who go in the mountains, mountain guides and mountaineers. And the communication is based of high-level possibility to send how many data it's possible, and with 5G, we can, for example, perform a remote intervention, a remote operation, or we can involve the robotic surgery. We talk about some things that it's not possible to translate in the field, but I don't know if it's really this situation. I think, but in the future, the robotic surgery and the possibility to perform operation at distance, it's the future of the rescue in the difficult environment. And one question, hospital training for rescuer also be necessary in the future. And if we consider the helicopter rescue and the common rescue in the Alps, I know that in the Andes it's very, very different because they are not the helicopter rescue system, but we can start from the criticism of helicopter rescue in the Alps, big distances, impervious territories, flight possibilities and problems. In the Alps, there is a full helicopter crew, but for example, not the same in the USA. It's this a critical point because in the USA use, for example, very big helicopters, and with bigger distances. Also, by my opinion, a doctor or paramedic on board is necessary. Distance from the first aid point from big hospital, usually more significant in USA, and the possibility with big machine to take treat while going, but reduction of helicopter agility, necessity of transport from rally to rally or plane on the field, more weight, less action range, and less space on board. The development of a new increasingly sophisticated technology, for example, EcoFast, this is a guide, a mountain guides, but perform ecography with a smartphone connected to a probe and send the imaging to a center with a doctor that can treat the imaging and send the correct indication. But this is most important because it's possible, for example, for a helicopter rescue to have some point for treatment before the operation. And some of you know all devices, mechanical CPR, and the possibility of ECMO treatment with a portable device and other device that we can use every day, and the app on the smartphone for the geolocalization and for geolocalization of the missing patients. And when 1 year ago in Lapland, Swedish Lapland, together with Giacomo Strapazzone of EURAC, we asked ourselves whether new technologies can really be used in difficult conditions, especially for the operators. The idea of using the T-Rex Cube simulation chamber was born together, not only to highlight critical issues and possible improvements in the field of the communication, but also to introduce advanced invasive technologies, REBOA and ECMO, but above all, difficult intubation and mini thoracotomy. This is the announcement of the program. We perform, for example, ECMO and REBOA cannulation by femoral artery in normal conditions, but other operations in extreme conditions. And the first result is the necessity of successful communication. Skills such as teamwork, communication skills, and leadership are essential to ensure effective rescue works even in the adverse conditions. And these are some pictures of the simulation of in difficult conditions. We are in a simulation chamber with 20 degrees under zero, with a hard wind, and in the night, we hear there is no volume, but it's very, very difficult to perform a rescue operation in this difficult communication. And the crucial point is the communication between the rescuers and between doctors and other lay rescuers. Some suggestions, for example, for REBOA. REBOA, it's insufflated balloon in the major artery of, for example, in the aorta, with a femoral access to stop the bleeding in polytraumatized patients not only to stop the bleeding, but to optimize the heart rate. And you can see in little ECMO device, but obviously I don't ask to arrive on the on emergency thoracotomy in the field, but this can be a future, I think. And for example, in difficult condition, 20 degrees under zero, difficult intubation, and positioning of chest drainage with the measurement of the time for the operation. It's more difficult, the intubation in very difficult conditions, 20 degrees under zero. The necessity of develop a search operation with a state of safety for rescuer using drone. This is another aspect of the future of the mountain emergency medicine. Also the artificial intelligence and the mountain rescue for a missing person when the smartphone, when there is no connection in the network for the research. And finally, why not introduce rescue at sea in a complete and exhaustive educational way? The objective is to integrate land, mountain, and sea rescue system to create synergies in an environment which, as we have seen, is no longer just land or sea. This is a slide from Michael Vancher with 8 children in hypothermic status in the sea, all victims treated with extracorporeal circulation and with complete recovery of the health status. And management of the territory is one of the most important. The training of mountain doctor and nurse, rescue intervention methodology that must be effective with attention to vehicles, more or less medical depending on needs. Obviously, if the first place of treatment, or the hospital, it's near the field of the injury the patients, it's not necessary to treat on board of the helicopter. But with big distances, can be necessary. A network for protection of the territory, ability to share experience and research as per lesson of the pandemic, the ability to innovate and break away from patterns self-referentiality. A new perspective that puts the healthcare professional at the center of technological development. And the role of high academic educational level. These are some pictures from master course in mountain emergency medicine, but born 12 years ago. And the aim is to create a doctor or paramedic with high-level skills, not only in the medical field, but in the mountaineering. And the collaboration with US Navy for rescue at the sea with 2 days, for example, of water survival, is only one of the last pieces of a collaborative effort aimed not only at increasing the advanced technological treatment on the field, but also at training a rescuer to the best use of the new technologies, even in extreme difficult situation. Collaboration with the Southern Medical course on the Andes, directed by Martin Musi and Darin Machas, will soon be added. And the future, it's the human factor. Human factor, we talk about new technologies, innovative improvement, but the most important thing is the doctor or paramedic, and a new revival of the figure of the mountain doctor, able not only to treat the chronic pathologies on the everyday pathologies, but also the mountain emergency medicine pathologies. The future is to combine rescue at sea, in the mountains, and space, and this can be a new approach against the consequences of climate change, and the old age advance, and the future is on the Alpine Lake, obviously with other apparel and not with Italian clothing. Thank you very much.